Hello, I'm Dr. Britton.
Hi, I'm Aida.
And I'm Michele.
And we are
West LA
Neurokinesiology.
So today we're going to sort of share some of our stories. Some of them might be relatable to you, but main thing is we do a lot of triaging, meaning after the patient leaves, we talk about their condition, we try to imagine what they're trying to do and what things are going to be getting in the way of that. And that's one of the ways that we really go over and above to try to make progress where they haven't had progress before. So we're going to all kind of share our stories. We're going to start with Aida, and just so you can sort of see what people end up going through and what kind of things we help fix, even if at the end of the day we're not the ultimate place that you get the final, your final treatment, okay? So with Aida, she has a very unique story. She, a few years ago, had a really bad pain that took her to the ER. And Aida, when you had that pain, was it like a 5 or a 6 or a 3 or 4 out of 10?
Oh no, it was 10 out of 10. It was the most excruciating stomach pain I had ever experienced. And luckily I was under Dr. Britton's care at the time. So, because this is something that I ended up going to the emergency room for it. And the emergency room that I went to was Hoag in Orange County, which is supposed to be one of the best facilities in the country, if not in the world. And so I went there feeling the worst pain of my life, and nothing was really done to find out what the problem was. No imaging, no exam whatsoever. And some of you might be able to relate to this problem because a lot of people have had appendicitis. But believe it or not, I lived with this pain for about 18 days. And it was only when I was visiting Dr. Britton when I was getting some relief, because he was trying to find out what the problem is, why I have all this pain in my abdominal area. And he recommended that I ice it, and most probably the reason why I was able to survive my appendix being ruptured was that he was recommending all anti-inflammatory treatments that I could do at home. And long story short, I ended up visiting 3 experts, 3 specialists, gastroenterologists, and Hoag, which is a great facility, but unfortunately...
Well, take them back for just a second. When you went to the ER, what did they tell you had?
They just said it's gastritis, probably just an ulcer.
And what did they give you?
They sent me home with 3 painkillers.
And did they give you like a milk of magnesia, Pepto-Bismol, or anything like that?
Nothing at all, just painkillers, like ibuprofen or Narco, something like that.
And when you were in there, just stay with me, keep going ahead. Stay with me. When you're in there, did you see the medical doctor?
I did not see any doctors.
Who did you see?
I just saw a PA and a couple of nurses.
Now, we're not talking bad about nurses. It's just that she she paid her money, and she didn't ever see a physician. And then when you asked them and you thought it was really, really bad, did they did they do an exam for appendicitis?
They did not.
Okay.
No, they didn't do an exam. Even when after 3 or 4 days, saw a specialist.
Stay on the ER visit. Right? So when they had you in there, they probably did some kind of exam. Did they touch you?
Briefly, just compressions.
Right. So when they did that, had they already give you medication before they did that?
1 medication.
Right. So they did the abdominal palpation for your pain after they gave you a painkiller, and then they decided that it's just gastritis.
Mm-hmm.
So then they sent you home. No imaging or anything.
No.
Right? And did your pain come back that evening when you got back home?
Yes, it did.
Right? And so when we start looking at it, they did follow certain rules like that insurance company set for it. When I ended up seeing you, my first recommendation was go get an MRI.
Yes.
Now, did your insurance say, yes, we want to do an MRI?
No.
Did your visiting doctor say go to an MRI?
No.
Did they give you a reason why they didn't want to do an MRI?
They did not.
Okay? So I believe in their thoughts, if they'd been back in med school, they would have said, yes, we should do it. Let's do imaging. So I sent her, because she'd been going through this pain. By the way, she's tough as nails. If your appendix blows and you're still worried about getting to work, and you go to work and work through it, you're a different kind of human being anyway. I'm not that tough. I would have called out for a month, right? But when we sent her in for MRI, the first thing that showed up was an abscess the size of a billiard ball or a pool ball. right? Where it had not only exploded, but now you had the rotting and the stuff going bad around it. And then, after getting the imaging, they sent you in, and then they had a whole bunch of things to do to you. Do you remember that?
Yes, absolutely.
Right? When they went through that, by that time, do you remember the diagnosis or what they said they needed to do before they did do surgery?
Well, they weren't even really sure about what they wanted to do, how they wanted to treat me. They really left it to me. Like 2 doctors came to see me and they said, well, it's up to you. We can open up your abdomen and try to take it out right now, or you can take antibiotics. What do you want to do?
And they wanted the antibiotics because when your appendix explodes, you're leaking things that are just nothing but really bad stuff into your body, right? And so I kind of agreed with their idea of going after the antibiotics, but at the same time, they were kind of looking at do surgery now or see if we can get the abscess to shrink and then do surgery. So at the end of the day, both wanted surgery, but this is 2 weeks after her appendix exploded. For me, if that's happening with something as routine as appendix, at someplace that great, what you're dealing with is the fact that the doctors or the normal medical system is overloaded, and good people get missed, and things that are abnormal, which is a human being having their appendix explode, still walking, those people get put into wrong categories. And I think some of you watching this have been put into wrong categories. Unless your doctor's willing to spend time, not your assistant, not this, but the actual physician who's taking responsibility for your case, you're going to find yourself suffering, like Miss Aida did. Now, did you end up having the surgery?
I did, but after the antibiotics actually got rid of the abscess.
Okay, got it, right? And so once they did the surgery, she's obviously here and taken care of fine. But if they'd followed their course and she'd never gotten the surgery, then anybody who knows what happens when you have a rupture and an abscess in your body, that's not going to be the future. And one of the side effects for that is there's tissue that she lost, and since this is going to be on the video, we won't go over, that came from not having that diagnosed in time. And for those of you who are arthritis or a nerve problem or neuropathy, the longer it goes without being diagnosed because your system's overloaded or the normal insurance way of doing things has left you as one of those people left out, you're never going to get the pieces of your body back that got lost during that time, just like Aida did. All right? So with that, I want to kind of go to a little bit lighter side because this might be a little heavy, but I want you to know just how severe these things can go. And we're going to just hear a little bit from Michele and what her experience has been. Hi, Michele.
Hello. So my experience was since 22 years old, I'm 30 now. Yes, I'm 30. I know. But since 22 years old, I've had severe arthritis pain in my right hand. And back when it actually started acting up was when I was in school to become an architect. I actually dropped out of School of Architecture due to the pain. I went through many of the best facilities out in Los Angeles, especially with unlimited amount of funds. I was able to go to the best places, yet I got zero help. Everyone's saying, you know what, you'll grow out of it. It's not a big deal. They gave me pain medication. They gave me some type of lidocaine to rub on it that didn't do anything. And now that I'm 30 years old, and within the first 3 months of working at Dr. Britton's office, he recommended that I use his laser machine. And less than two or three sessions, I think you did on me, and I've worked here about 5-6 months now, and I've had no pain. I'm able to wear rings. I'm able to draw again. I just feel like a brand new person ever since. So that is my story. Unfortunately, it's not as deep as yours. So I'm sorry to fail you guys, but it's just something so minimal did such a big change to my body and to my lifestyle, as opposed to spending all this money, wasting all this time at all these other facilities that truly did absolutely nothing. So thank you.
You're welcome. You're welcome. And again, one person is married, one's my case manager, so you guys can take the bias where it goes with that. For me, one of the reasons I do what I do is because I was involved in a car accident. Back in 1998, I was walking along Ventura Boulevard, and someone had stolen a construction truck off of a construction site on Laurel Canyon. And unfortunately, the construction site was going bankrupt. That's why the truck was able to sit there. And he was driving from Laurel Canyon onto Ventura Boulevard, and he hit me at about 40 miles an hour when I was walking. Well, that's hard enough. I mean, I'm heavy. I'm not the lightest guy, but that's hard enough to knock me in the air. And then he ran over me and tried getting away. So long story short, they had to land a helicopter up there near Ventura Boulevard. I got my first $12,000 helicopter ride. They took me to UCLA. And I want to say, thank God for emergency medicine, because what I do doesn't fix people who got ran over by cars to make sure they're stabilized. I had to have surgery on my knee, problems with my back, and when they were done, you know, they put me in a wheelchair. They saved my life. I want to be really clear about that. But I was in 10 out of 10 pain. My hips were partially dislocated. The nerves in my low back had been messed up to the point that I ended up having to wear a diaper because the nerves that go down to that area had been damaged enough that I wasn't in full control of urine and defecation. And so my dad's ER doctor, they made sure we went to the best places I could possibly go. And at the end of the day, 6 months later, I was in taking Medicaid's pain pills, as many pain pills they give me. I wasn't able to work, and I wasn't able to go back to PT school at that time. I wasn't able to just do the things you need to do as a manual therapist. Here's what's funny. My roommate at that time was a dancer, and one of the things she was going to a neurokinesiologist for is because she was dancing for people like Pink and Madonna and things like that. And she says, listen, we have this really great doctor. He's kind of kooky, but he's really great. You should see him and make sure that we're able to survive the things that dancing does to your body, especially when you're dancing from 13 years old all the way to your mid-20s. So I went, and it was a very apprehensive moment because I didn't know what he does, and I'd never heard the word neurokinesiology before. And he looked at my case, and he looked at my x-rays and my MRIs and looked at how I was moving, and he said, well, the hard part for you is you're going to have to do a lot of work. But if you do a lot of work, I can get you back to pretty much normal, feeling like a normal human being. He introduced me to laser. He says you can use it to help my nerves be able to reestablish their connection to the muscle. He's going to be using something called direct current electricity to be able to make those currents stronger. He's going to be doing physical therapy and rehab, but along with using something called decompression. So just like you, I just really never had heard all these words together. But I trusted him, and I gave him a chance. Plus, he took my personal injury insurance, so I wasn't risking as much as maybe you might be risking when you come trust me. And within 3 months, I was able to take the diapers off. And for rehab, he sent me back to a place called Rock Creation, a rock climbing gym, and he said, listen, start light, but when you're on the wall, I want you to just stay, no ropes or anything, just practice moving on the walls and doing things so you can regain your confidence in your own body's strength. And you know what, guys? Within 12 months of the time that I started seeing him, I was rock climbing, lead climbing. I was able to move the way I wanted to do. I was able to go out on dates again. And I had to ask him, I was like, how did you learn all this? Which med school did you go to? And he's like, listen, what I do is kinesiology, looking at the movement of your body, studying how the spinal biomechanics work. We're using laser for tissue regrowth and tissue reinnervation by helping the mitochondria work better. We're using decompression, and I'm using a combination of chiropractic because the basis of chiropractic is the body heals itself. And that's a total different mentality from getting a bunch of injections, because some of them actually, if you don't feel pain, but the area is injured and you use it, you're going to make it worse. So he said, that's why it took so much out of you. You had to endure the pain as you naturally healed. And my job was to be sort of like a crutch that you could help get yourself back together again. And it took a long time. We spent a lot of hours together, but after a year and a half, I'm almost normal. You can ask my wife. Sometimes I'm not a normal person. But I wanted to share that with you because some of you think you're so far gone, nothing can fix you. My cases are no longer miracle cases. They're just chances for people to have somebody to spend enough time to explain what's really going on with them. So we're going to use 3D diagrams and things like that. This video, again, is way longer than I anticipated it to be, but I hope this gave you some information and some things that when you walk in the office, that we're not starting way down here. If you start me explaining basic biology to you, you're never going to get to the point of figuring out how to be healed. We end up starting out somewhere about here, so that way we can get you the rest of the way healed, or at least tell you what we can do, what we can. I hope this was useful for you. I know it's long. If you listen to the whole thing, then you should definitely pick up the phone and call. If nothing else, trust your subconscious. If it sucked, you would have clicked this off in 12 minutes, and well before 12 minutes. Thank you very much, and have a great day. Hope to see you in the office.